Advanced care planning is a conversation that you have with yourself and your loved ones, and it's basically making decisions and examining how you feel about life and your healthcare decisions, planning for what to do in the case of a serious emergency, a serious medical emergency, an accident, things like that, so that your family and you are aware of what you would want to have happen if there were a surprise medical condition or accident that came up.
Advanced care planning is a really important part of just your healthcare experience. It can be done across the continuum. As a young person, to talk a little bit about what would happen if something emergent or unexpected transpired, all the way up through the end of life when maybe death might be imminent and you want to make sure that your family knows what your wishes are.
Advanced care planning is really important to providers because ultimately, all too often, we are faced with a patient that we've never met before. We have no experience with, longevity with, we have no knowledge of what is important to them, and we have to make really rapid decisions regarding their care.
The biggest fear is nobody wants to talk about end of life and that care, and so it's a scary topic and subject for so many, but they need to understand that it is your wishes, and it's great to have people involved in that and know what you want. And like for me personally, I am a widow, and so I wanted to make this simpler for my 3 children. They've gone through it with the loss of their father, and this was one of the last things I could do to help them in this process, so not everything was on their shoulders. They could follow what my wishes would be.
Often I hear that advanced care planning isn't important for younger individuals who are healthy, but unfortunately accidents can happen to anyone, even the young, and so it's important for them to think about who they could trust that they'd want to make decisions for them if they were suddenly unable to.
I think all people need to have the discussion, starting at age 18. What would you want done? Do you want to be fed through a tube? Do you want to be on a ventilator for an extended period of time? What are your wishes if you would have to go to a group home setting? What kind of wishes? How do you feel about that?
I think we can sometimes assume that our family members might know what we want as far as care if we're not able to communicate those desires, but assumptions aren't always correct, and it doesn't hurt to have those conversations and make sure that everyone's on the same page with what you are wanting.
It's never too early to start that conversation. They will appreciate it, the patient will appreciate it, and the healthcare provider will appreciate it, regardless of your age. It will alleviate the burden of those that are making those decisions, knowing that they did what you wanted and what your wishes were. We can assist you with getting the information. We can assist you with filling out the form. We can assist you with the conversations that you have with those that you appoint as your healthcare provider or with your family as a whole.
Appointing a healthcare agent is important because if you're unable to communicate for yourself, you're going to need someone to make those decisions for you. Deciding who's that person's going to be in advance allows you to put some thought into it. It allows you to have time to have conversations with that person so that they are aware of what your wishes are. You want to make sure that it is someone who can make decisions in high-stress situations and who are willing to follow your wishes even if they don't agree with them.
Sometimes you need to have an initial conversation and say, we'll talk about this again tomorrow, when you've had a little time to think about it, reflect upon it, pray about it, whatever it is that's important to you. Maybe converse with somebody who is close to you, a good friend, somebody who's your spiritual advisor. But I think the most important thing is just have the conversation.
When a patient would come to meet with me for an advanced care planning session, I would encourage them, if they already have a healthcare agent identified, to bring that individual with them. We would spend time talking about advanced care planning and advanced directives and clarifying any misconceptions they might have. We would talk about their fears, their beliefs, their values, anything that might come into play with medical decisions down the road. We'd talk about their goals of care, and we would get started filling out an advanced directive.
I've had a lot of experiences where patients have come to me. They often ask me before leaving, where on earth has this been for the last several years. This was the most important conversation I've had with a doctor that I can think of.
Advanced care planning is free. There is a packet of forms that are easily accessible, printed out, that you fill out free of charge, and we're just here to help you go through those with your loved ones.